Patients Like Me is a social media website designed to allow patients to pool their experiences of disease and treatments for a bottom-up approach to link patient support and medical research. Jamie Haywood founded the company and the nonprofit ALS Therapy Development Institute to help his brother Stephen, who died of Lou Gehrig's disease in 2006. Jamie, thanks for joining us.
It's great to be here.
Now, you founded Patients Like Me to help your brother Stephen. How did it help him?
Well, you know, in the beginning, because we'd done all this work at the Institute, we thought that we knew a lot about ALS, and we really wanted to help Stephen share with others. And, you know, and interestingly, if you really want to feel better, helping someone else is almost the best way to do that. What surprised me is that even after all of these years of research, as soon as the community opened, and, you know, and there were initially just a couple of hundred ALS patients, I was learning things that I never imagined I could have known as a researcher. And it was really humbling to realize how much patients could teach us about how to do better understanding of disease.
Well, I know on the website right now there's about 2,000 conditions that are represented there. I want to take a look at a testimonial from Leticia, and she said she found help for her epilepsy.
Yeah.
I was about 10 years old, and that's when I was formally diagnosed with epilepsy. I went to many doctors throughout my life trying to find answers. It was very confusing at times and frustrating. Patients Like Me changed my life because it gave me a lot of the answers that I've been searching for. I was able to track my symptoms, my treatments, triggers, interact with other people who are suffering with seizures and epilepsy.
So she talks about finding these, you know, this community that helped her. What kind of tools and support can you find on this website?
Well, you know, she would come in and she'd be interviewed, and she would go through her diagnosis history, how she'd learned she had the disease. She'd be able to track the treatment she used to use and the one she used now in a way that would allow her to share it with her doctor and make better decisions effectively. We tracked the kind of doctor she saw. So in her case, it was finding that epileptologist that made the difference and really got her better treatment. And all of that, including the things she does just to make her life better, you know, subtle things, are part of the community. And then people dialogue about it. And it's that combination of stories and data that make it work.
Well, being a registered nurse, I have to admit I'm a bit skeptical of public comments on medical websites because I feel there's not a lot of accountability. How is your site different than other websites, for instance, maybe WebMD?
So that's actually a great point, because normally on the internet, what you find is the edges. You find the people that had the worst experience and the people that had the best experience. On our site, you find everyone, because we share all of the components. And so I think that plus we have really good moderation and medical personnel that oversee the data. That's what makes the environment safe and really interactive and adding value in a new way.
And that's sort of the community part, but how does your website link patients to researchers?
So every patient has the chance to fill out sort of a battery of information about their disease. It's sort of, you could almost call it a dating site crossed with a clinical trial. And the same questions that we would ask in a study are asked of the patients. We then take that data and we use it to sort of understand the disease, identify how symptoms relate or don't relate, or even build predictive models so that we allow ourselves to see into the future and what's going to happen to people if they are more effectively treated or less effectively treated.
Is it sort of a crowdsourcing for these conditions?
Yeah, it's a combination of crowdsourcing, but because we use a common data structure, that it allows people to compare information across each other.
Well, I know Patients for Me is a nonprofit business and recently announced a partnership with Genentech, an arm of Roche Pharmaceuticals. Part of that deal gives these companies sole access to data, I understand from your site. Have members expressed any concern about how their data is being used?
Well, it's not sole access, and this is really important. The goal of the site is to create shared data. So what is really exciting about the Roche Genentech partnership is that they've, the first, and there's many more now coming in to support this, are committed to building an open registry where patients can share data with each other, we can advance academic research, we can advance the nonprofit agenda. And the life sciences companies, for the first time, have a way of really connecting to patients and learning all in one model. So they don't have anything exclusively. This is about making the resource better for everyone.
I see. How do you protect patient privacy for people who want to come on and share? Is it open?
So privacy is a really important right, and anyone that has a medical condition or a problem that they're worried would affect their job should be very careful about the whole internet. I mean, you go into Google and you type, if you search for an HIV clinic in Google, a marketing company, all they do, they have no restrictions, has that information, they know what's going on with you. We treat this differently. The rules are, if you come, you're committing to joining a community of people that are sharing with each other. And the safety is in that you are actually not using your name, but we really want people to know this is open, and you're going to be used, your data is going to be used for research, it's going to be used by other patients, people are going to question and dialogue with you. And if you're not up for that, this is not the site, but if you are up for crowd medicine, to learn from each other and help out each other, we're the place to do that.
So it's full disclosure on what this is. What do you see as the next level of healthcare using technology?
So, we live now in a world where we do 50,000 siloed experiments every year. That's not working. We need to do one big experiment. We need to learn what happens to people over time, and we need to be able to use this amazing new technology to understand disease. That's what we're building towards.
All right, well, we look forward to seeing what else happens next. Patients Like Me founder Jamie Haywood, thank you so much.
Thank you.